Can you avoid any of these problems before the weight loss? Someone's decided to come to you and you're working with them right now. So is there a way to at least ameliorate this a little bit, to stop it from happening too badly?
I will tell you, the only way is pretty much avoiding the excess weight gain. That's unfortunately one of the things, because these tissues are going to be, one of the things that I've noticed, Ed, is that what will happen is, if patients work out or do some exercise, sometimes some of this, if they're able to, some of that volume that is lost with fat is replaced by increase in volume in muscle. Sometimes some of these discrepancies are less noticeable, but it doesn't mean it doesn't happen. It's just a little bit emasculated by that volume being replaced by muscle instead of by just skin.
What about, and I just want to make sure, because I know we were going to talk about this, what types of body contouring options are there for that sort of frame?
Well, once you've lost the weight, you're going to have excess skin. And I told you the most important thing is first talking with the patient and seeing what bothers them the most. One of the most common things that we will have, and I think the biggest thing that bothers a patient, because it affects their functional status as well as their lifestyle, is the excess skin around the abdomen. And this is an area that we would excise. We will do almost what it's called a paniculectomy, when you excise the skin that lands in front of your genitalia and perineal area. And sometimes we do this circumferentially. Sometimes we do a combination of an abdominoplasty, which will go higher. And then it can be 360. So the patient will have, in this single surgery, essentially you will excise all of the skin, considering the skin in the back. You will elevate some of the gluteus, and you will excise the skin in this area.